remarks. Madam President, there's a lot of talk from the majority about why passing this bill is the right thing to do for the American people. It's the decision of conscience for them. Well, let us take a closer look at these decisions of conscience. After weeks of closed-door clandestine negotiations, Senator Reid finally emerged with a 383-page Christmas list. This bill is a dark example of everything that is wrong with Washington today. And despite all the promises of accountability and transparency, this bill is a grab bag of Chicago-style backroom buy-offs. It is nothing more than a private game of let's make a deal with the special interest groups financed by American taxpayers. So who won and who lost in this game? Well, let's take a closer look. The AARP issued a strong statement of support for this bill. The Reid bill slashes Medicare by almost $500 billion to finance additional government spending. So why would the nation's largest lobbying organization, avowed to protect the interests of seniors, support this legislation? To find the answer, like anything else in Washington, just follow the money. AARP takes in more than half of its $1.1 billion budget in royalty fees from health insurers and other vendors. The sale of supplementary Medicare policies, called Medigap plans, make up a major share of this $1.1 billion royalty revenue. AARP has a direct interest in selling more Medigap policies or plans. However, there is a strong competitor to Medigap policies, and that happened to be the Medicare Advantage plans. These private plans provide comprehensive coverage, including vision and dental care, at lower premiums for nearly 11 million seniors across the country. Seniors enrolled in Medicare Advantage do not need Medigap policies. So what happens when the Reid bill slashes this program by almost $120 billion? That's with a B. Just look at the Washington Post front page story from October 27th, questioning whether AARP has a conflict of interest. I quote, "Democratic proposals to slash reimbursements for Medicare Advantage are widely expected to drive up demand for private Medigap policies like the ones offered by AARP, according to healthcare experts, legislative aides, and documents," unquote. That's from the Washington Post. One of the most disturbing developments in the Reid bill has been the perpetuation and even the doubling of the unconstitutional mandate tax from $8 billion to $15 billion. You heard me right. This unconstitutional mandate tax actually doubled behind closed doors. I have long argued that forcing Americans to either buy a Washington-defined level of coverage or face a tax penalty collected through the Internal Revenue Service is highly unconstitutional. We hear a lot of rhetoric from the other side about Republicans defending the big, evil insurance companies while they are the defenders of American families. The insurance mandate is a clear example of this partisan hypocrisy. Let me ask one simple question. Who would benefit the most from this unprecedented, unconstitutional mandate to purchase insurance or face a stiff penalty enforced by our friends at the Internal Revenue Service? The answer is pretty simple. There are two clear winners under this draconian policy, and neither is the American family. The first winner is the federal government, which could easily use this authority to increase the penalty or impose similar ones to create new streams of revenue to fund more out-of-control spending. Second, the insurance companies are the most direct winners under this individual insurance mandate because it would force millions of Americans who would not otherwise do so to become their customers. I cannot think of a bigger giveaway for insurance companies than the federal government ordering Americans to buy their insurance products. If you do not believe me, then just look at the stock prices of the insurance companies that have recently shot to their 52-week highs. Jane Hampshire, the publisher of the very liberal blog Fire Dog Lake, said the following in a recent posting, quote, "Having to pay 2% of their income in annual fines for refusing to comply with the IRS acting as the collection agency just might wind up being the most widely hated legislation of the decade. Barack Obama just might achieve the bipartisan unity on health care he always wanted. Democrats and Republicans are coming together to say, kill this bill." Now that we clearly understand the huge windfalls the Reid bill provides AARP and insurance companies, let me take a moment to talk about the winners and losers in the so-called abortion compromise. The language to prevent taxpayer dollars from being used to fund abortions is completely unacceptable. The new abortion provisions are significantly weaker than the amendment I introduced with Senator Ben Nelson to ensure that the Hyde Amendment, which prohibits use of federal dollars for elective abortions, applies to any new federal health programs created in this bill. The Hyde Amendment has been public law since 1976. The so-called abortion compromise does not stop here or there. The Reid bill creates a state opt-out charade. However, this provision does nothing about one state's tax dollars from paying for abortions in other states. Tax dollars from Nebraska can pay for abortions in California or New York. This bill also creates a new public option run by the Office of Personnel Management that will, for the first time, create a federally funded and managed plan that will cover elective abortions. When you have Senator Boxer, the distinguished senator from California, and Speaker Pelosi, the distinguished Speaker of the House of Representatives, two of the largest pro-abortion activists, advocates in the Congress supporting this sham so-called compromise, and everyone from the U.S. Conference of Catholic Bishops to the National Right to Life Committee and Family Research Council opposing it, there's only one clear loser, and that's the majority of Americans who believe in the sanctity of life and oppose the use of federal dollars for abortions, for elective abortions. Last but not least, I would like to spend a couple of minutes to talk about the numerous special deals conferred on states in this $2.5 trillion spending bill. How hefty are the price tags for decisions of conscience? Here are some highlights: $300 million for Louisiana, $600 million for Vermont, $500 million for Massachusetts, $100 million for Nebraska, and that's just the beginning. At a recent news conference, when the authors of this legislation were asked about the Nebraska earmark for Medicaid funding, the majority leader simply replied, quote, "A number of states are treated differently than other states. That's what legislation is all about. That's compromise," unquote. Now, the next logical question is pretty straightforward. Who will pay for these special deals? The answer is simple. Every other state in the union will pay for these special deals, including my home state of Utah. All of these states who are collectively facing $200 billion in deficits and are cutting jobs and educational services to survive will now pay to support these special deals. According to the Congressional Budget Office, the Medicaid expansion in the Reid bill creates a $26 billion unfunded mandate on our cash-strapped states. Coincidentally, only one state avoids this unfunded mandate, and that is the state of Nebraska. Of course, let us not forget about the biggest loser in this bill, the hardworking American taxpayer. This bill imposes over $500 billion worth of new taxes, fees, and penalties on individuals, families, and businesses. The new fees begin in 2010, while the major coverage provisions do not start until 2014. Almost $57 billion in new taxes are collected before any American sees the major benefits of this bill, which are largely delayed until 2014, assuming that they are benefits at all. It's also no coincidence that through the use of these budget gimmicks, the majority can claim this bill reduces our national deficit when we all know these reductions will never, ever be realized. Based on data from the Joint Committee on Taxation, the nonpartisan congressional scorekeeper, this bill would break another one of President Obama's campaign promises by increasing taxes on 42 million individuals and families making less than $250,000 a year. At a time when we are struggling to fight a double-digit unemployment rate, the Reid bill not only increases payroll taxes by nearly $87 billion, but also imposes $28 billion in new taxes on employers that do not provide government-approved health plans. These new taxes will ultimately be paid by American workers in the form of reduced wages and lost jobs. However, it is hard to say we didn't see these new taxes coming. For years now, many of us have warned that the out-of-control spending in Washington will eventually have to be repaid on the backs of the American families. In this bill, the repayment comes in the form of stifled economic growth, lost jobs, and new and increasing taxes. And they are just the first installment of what will be a long and painful extortion of taxpayers if Congress doesn't stand up and stop these terrible bills. According to a recent study of similar proposals by the Heritage Foundation, these new job-killing taxes will place approximately 5.2 million low-income workers at risk of losing their jobs or having their hours reduced, and an additional 10.2 million workers would see lower wages and reduced benefits. Poll after poll tells us about the growing opposition against this tax and spend health care bill. The latest Rasmussen poll shows that 55% of Americans are now opposed to this bill. The CNN poll is at even higher at 61%. Among senior citizens, the group most likely to use the health care system, only 33% are in favor, while 60% are opposed. Independent voters are also opposed 2 to 1. Opposition in certain state polls, like Nebraska, is even higher at 67%. So what is the majority doing to address these concerns? Nothing. In fact, despite the efforts by many of us here on this side of the aisle to express our substantive policy disagreements for months, one senator recently said the following, quote, "They are desperate to break this president. They have ardent supporters who are nearly hysterical at the very election of President Barack Obama. The birthers, the fanatics, the people running around in right-wing militia and Aryan support groups, it is unbearable to them that President Barack Obama should exist," unquote. Now, that statement is outrageous. It was made by a very dear friend of mine, and I know that he probably didn't mean it the way it comes out, but it's outrageous. Instead of listening to the policy concerns of a majority of Americans, the other side is simply dismissing them as rants from the far right. If the majority refuses to listen to what Americans are telling them now, I'm sure they're going to have a rude wake-up call waiting for them later. It should come as no surprise to anyone that this kind of arrogance of power has led to congressional approval ratings rivaling the most hated institutions on the planet at a dismal 22% and falling. One of the biggest tragedies of letting this bill move forward is that it will do nothing to address the fundamental issue of rising health care costs in this country. According to the Congressional Budget Office, CBO, this bill will actually raise our national health care costs by $200 billion. The administration's own actuary at the Centers for Medicare and Medicaid Services, CMS, agrees with this assessment. When this bill fails to work, Americans will no longer have any faith in Congress to effectively address the issue of health care reform. The opportunity to save Medicare and Medicaid from their impending financial collapse will be lost for another generation. The historic blizzard in Washington earlier this month was a perfect symbol of the anger and frustration brewing in the hearts of the American people against this bill. I urge the majority once again to listen to the voices of the American people. Every vote for this bill is the 60th vote. Let me repeat that again. Every vote for this bill is the 60th vote. My Republican colleagues and I are united with the American people in our fight against this $2.5 trillion tax and spend bill. Now, I implore my colleagues not to do this to the American people. Don't foreclose on their futures. Don't stick them with even more government spending and more government intrusion. We can fix health care. Many of us have been working to do just that for many years. A truly bipartisan bill that would garner 75 to 80 votes, as has always been the case in the past on these major pieces of legislation in the Senate, would be fiscally sound and provide the American people with the fixes they are asking for in the health care marketplace, and it would be easily achievable if we would just open our hearts and work together. Many of us are standing at the ready and have been for months to step forward and pass meaningful health care reform that truly would help American families and please American taxpayers. To date, we've been rebuffed by an unfailing determination by a few to pursue a nearly socialist agenda. I would ask my colleagues on the other side of the aisle who do not believe in the Europeanization of America, who believe in doing truly bipartisan work here in the Senate, to step forward and vote against advancing this bill and work with those of us on this side of the aisle who are committed to making a difference to craft a health care reform bill that they can be proud to support. Now, having said that, I do praise my friend and colleague from Montana, Senator Baucus, who